Hello. Just going to get my stuff set up. It's been a very busy one in clinic today. I hope everyone has had good days. Hopefully not quite as busy as mine. Let's wait for a few minutes, get people joining, and then we can get cracking and go from there. Hi Les. Put my phone on silent. Hi Catherine. Thanks for joining. Get started in a couple of minutes. Hope everyone's managed to stay cool in the heat today. We were meant to be getting our air conditioning sorted today, but of course there's a problem. We can't get it sorted till Wednesday, so I will be boiling, as you can see, until then. Fab, let's get started. Anyone that's not with us immediately can always catch up anyway. Today we're going to be talking about tennis and golfer's elbow, medial and lateral epicondylopathy. Quite the mouthful. That word, epicondylopathy, is sort of how we describe the medical term for tennis and golfer's elbow. There's been 3 different names for it in the last 10 years since I first started studying. We used to call it medial and lateral epicondylitis, and then we were calling it medial and lateral tendinopathy, and now we're calling it medial and lateral epicondylopathy. Which I think is most likely because if it's got itis at the end of the word, then we assume that there's some inflammation there, whereas with tendon issues, actually, there often isn't any inflammation present, so hence why it's now called epicondylopathy. So, quite the mouthful. So, medial epicondylopathy, or golfer's elbow, is a tendinous overload injury to the medial side of the elbow. So, medial is inside, so that means here. And from the overload, that can cause then a tendinopathy as a result. Flexor and the pronator tendon can sort of have degeneration that occurs over time, and it's often with sort of forced or repetitive wrist extension and wrist flexion and forearm supination. So there's a fly that's doing my head in. So during kind of activities that involve quite a lot of those movements, that's when we might see damage to the tendon. The most sensitive region that we tend to see for this is located near the origin of the wrist extensors, so kind of wrist flexors, around here, around the medial epicondyle of the humerus. Sometimes as well, you can also experience pain in other areas, so it does kind of vary, but this is typically where we see it. And when we're thinking about our tennis elbow, is on the other side, so it's on this side here. Typically patients get a lot of pain around their sort of bony bits of their elbow that we call the epicondyles. Again, it's that kind of same mechanism, lots of wrist extension, flexion, pronation, supination. All of that can then ultimately result in an injury at the elbow. Fun fact for you, only 5% of people that have tennis elbow actually got it from playing tennis. The majority of people did not. Like I said, typically these injuries kind of occur from repetitive actions. So we often see it in people that have a lot of computer use, so everyone that's sitting at their desk typing away. Can be heavy lifting, and the reason for that is, although if we're kind of lifting heavy stuff in the gym, for example, and our wrists are kind of fixed, we're doing a lot of gripping, and that gripping action can upset our elbow as well. But just by sort of stuff we might do in the gym, if we're heavy lifting, maybe it's like big boxes if you're a manual labourer, or bricks, or whatever it is that you might be doing. What's happening then is sometimes our wrists are kind of caught at awkward angles. Maybe you're having to carry lots of things for a long period of time, and that can cause it as well. And anything kind of really forceful with sort of pronation, supination can cause issues with the elbow. The other interesting one too is vibration. So I've seen it before with people on, I've forgotten the name of it, but when you're trying to like get pavement to break up. And, they're very loud, but I've completely forgotten the name, it's gone up my head. When you see people on those kind of machines, the heavy vibrations from that can cause issues at the elbow, as well as from chainsaws and things like that too. So it's just something to consider. Typically in clinic, we see this from people that do lift kind of heavy things in the gym, but often I see it from people that have been doing DIY at home. Maybe someone said to them, oh, we need to get this fixed or this, and they tend to be doing a lot of screwing with their hand and that kind of pronation, supination action. And then they wake up the next day and their elbow is so sore and they're really confused, so it didn't hurt at the time, so have I done something serious? And then they generally come to us a week or so later when it's really bad and still not getting any better. If we're looking at kind of how we diagnose this injury, possible subjective findings. So subjective is the things that you're telling me when you come and sit down in my treatment room. So often the onset of the pain is kind of 24 to 72 hours after the activity that has provoked it. Very thirsty today with all of the warm weather, sorry. So yeah, typically 24 to 72 hours after that movement that has really provoked it. Pain often may radiate sort of down the forearm and as far as the wrist and the hand as well. So that is possible. You'll often say to me, oh, I have difficulty kind of lifting and gripping. Something people often notice is shopping bags. Previously they didn't have a problem carrying shopping bags. Now they're really struggling carrying shopping bags. Even things that aren't that heavy, sometimes the pain forces them to drop things as well. And then also changes in sort of biomechanical factors as well. So this would be something like a new tennis racket, new squash racket, sort of doing overtraining, poor technique as well. So anything like that could cause an issue at the wrist. The other thing, sorry, at the elbow, the other thing that could also cause an issue at the elbow is having an injury somewhere else. So like a shoulder injury or a wrist injury, for example. This might then force you to overuse that area a little bit more. And as a result of that, it's going to take on more force and more load. And then it might just get to that point where it kind of just stops. It's unable to kind of take any more. Often when I'm then assessing the patient, I find pain, sort of quite pinpoint tenderness over the epicondyles and just sort of distal too. So these are our epicondyles. I'm not sure you can really see it on me. There you can see that one. It's quite prominent, bony. So often there'll be kind of pain around there. And on this side, which can't see it as well. There'll be pain kind of down there if I'm kind of poking around. It's sort of 1 to 2 centimeters below the sore spots. You'll often see pain and weakness as well on wrist movements. So we'll do some resistive tests just to see, okay, which areas are strong, which areas are weak, and sometimes there is some weakness in those movements. Weakness on grip strength, that's the common one. Like I said, people, although we test it in clinic, we've typically already been told that you're struggling to carry your shopping, you're struggling to lift a barbell or a dumbbell in the gym, anything like that. So they're the kind of things that we kind of look for as well. And then pain or kind of less movement than we'd expect on elbow flexion, elbow extension, so these movements sort of passively, so that's when I'm doing it myself for people. And then also on ulnar and radial deviation, which is moving this way and that way. I kind of don't get too much movement that way, I get quite good movement that way. We expect maybe as well to find weak elbow sort of extensors and flexors possibly, especially if this is something that's been going on for a long time. And it's interesting when you read the research around weakness with tendon injuries, a lot of it is chicken egg. Like, was the muscles around that area weak and that caused the tendon injury, or is it as a result of the tendon injury that we've then got this weakness? And it depends. If someone's coming to us quite soon after an injury and they seem weaker than the other side, the chances are the weakness is sort of there predisposing it. If they say, oh, I've been having this problem for 3 or 4 months, the weakness might just simply be that person's not using that side as much as before due to the pain. So that's how it's got weak. We then also do some special tests as well. So our special tests kind of help indicate to us, are we on the right path? Is there something else? Because there are other conditions that can mask as tennis or golfer's elbow, particularly for tennis elbow annular ligament, which is a ligament that kind of comes around in a loop at our elbow. Sometimes that presents quite similarly to tennis elbow, but it's not, it's a different injury, it needs to be managed slightly differently. So we want to do specific tests to just work that out for people. So we've kind of covered what they are, how we diagnose them, and now we're going to go on to how they occur as well. Now we're going to go on to what treatment can we do for them. So obviously education and advice is really important, and that is on sort of how to manage your pain, how to modify activities and that kind of thing. Something which I often end up using a lot for people is, you may have seen people wearing them in the gym, like a strap that goes across here. Typically I wouldn't recommend kind of braces and supports and that kind of thing unless necessary, but the thing is with this band is if, for example, you are a manual labourer and this is really affecting your work, or you're typing at your computer and it affects your work, whatever it is, if it's getting to the point that you can't work, I'm going to give you something that allows you to work, even if long-term wise maybe it's going to sort of hinder your recovery slightly, or just sort of not hinder it but slow it down. So with these bands, what they do is effectively almost like cut the tendons off early, where you put it across here, that bit of the tendon can't be used, your muscle then gets forced to be used a little bit more, and by doing that it basically gives the tendon a bit of a rest. The thing that we don't like about it is tendons need to be moved, they need to be worked, and that's what they respond to when we're thinking about how to heal them. But if you can't work because you are in pain or you've got some kind of problem issue there, it's important that you're still able to do those activities. So putting the strap onto the arm for when you're doing those activities and taking it off when you do your exercises can be an effective way of managing it, albeit kind of temporarily, but can help. And then the other things that we're sort of looking at as well is like ice and massage, so sort of massaging off all the tightness in the forearm area, getting into the tendon a little bit as well. I find acupuncture works quite well in this area, so often I will do that too. Doing some supervised exercises, so strengthening and stretching certain areas. I would say with stretching tendons, we want to be very careful because tendons often don't like compression. So stretching can make it worse. But some people may find it beneficial, and if they do, I'm probably not going to stop them from doing it. But I just give out a warning. But we know that strengthening is obviously incredibly important, and as I've spoken about in other lives, and if you want to be tagged in other lives on tendon injuries, then just let me know. But we can either use heavy slow resistance or eccentric training. Sorry, got a frog in my throat. So with eccentric training, what that is we're sort of slowing down part of the movement so that we can get the kind of the full action of that tendon and put it under extra strain and then bring it back to the normal position. And what that does is it can cause sort of an increase in exercise-induced muscle damage, which means that then we can get that tendon work stronger and harder. With tendons, we need to be working at about 70% of their capacity to really get any meaningful change in them. So if we're doing anything less than that, it might not be too effective. And this is the thing with kind of tendon injuries in general, but particularly with sort of stuff around the elbow, lots of people think, oh, it's so painful, I'm just going to rest it, and they rest it for a couple of weeks, it feels better, and then they go back and they do something else again, and it's just going around in this cycle. And actually with tendon injuries, they need to be worked, they need to be loaded, we just need to know how to do it. So eccentric training is one of the options. The other option is heavy slow resistance training, and what that is you'd be holding a weight, you'd be going really slow on the eccentric part of the movement, which is where the muscle is contracting but also lengthening, and then you come back to normal. You probably do around 6 to 8 repetitions, 3 to 4 sets, and you want to be working until kind of fatigue doing that. Both of these methods have been shown to be equally as effective across a 12-month period. We do see with heavy slow resistance that it's better sooner. The pain reduces quicker with heavy slow resistance than it does with eccentric exercise, but both will work effectively. So with patients, I just sort of do it based on what equipment have they got, how manageable are things for them to do, etc., and kind of go from there. We can then look at manual therapy as well, sort of to do with mobilisations. We sort of mentioned massage already, but joint mobilisations can be quite effective at the elbow. And then sort of sport or like occupational kind of specific rehabilitation, because what we don't want to do is get someone really strong and then be like, okay, you can go back and you can play tennis now or golf or whatever it is that they're doing, and then it all goes to the pot. You know, we obviously don't want to have that. We want to get them back stronger, so that's when we start then using their tennis racket for things, getting more sport specific actions in the gym and things that we're doing, and start involving more and more joints into our rehabilitation process as well, because we want to be able to get you working not just one area but multiple areas, because that's how our body works. We are constantly using multiple areas at the same time. And we'll also be assessing things like use of your tennis racket, and that might not be for us. You might say, have you got a coach that, you know, can look at your grip on your racket, unless, you know, one of us is a specialist in that. I previously played tennis. I'm not playing anymore. I'm probably not the best person to look at your grip and where you're holding your racket and stuff, but most people's coaches are going to be able to help support them in that. And also, if you're not sure if you've got the right grip and the right weight of racket for whatever sport, you know, where the place that you go and buy your rackets from are normally very good and able to assist you with those things. It might be that the racket you're using is too heavy for you, the grip isn't correct. So we just want to try and generally get on top of all of those things. Now, if we're looking at preventing these injuries, because obviously the best thing is that they never happen to start with, the best way to prevent them is to make sure that you're never having like a big spike in any kind of load that you're doing, and that you're obviously looking after the health of your tendons and your muscles by stretching, keeping them nice and relaxed and that kind of thing, but also making sure you're doing regular strengthening. Your elbow is probably neglected when it comes to strengthening. People strengthen their biceps and their triceps. People aren't really strengthening their wrist flexors and extensors. So that's something that you can look into, but we want to be kind of looking at everything as an overall picture, that we don't want to have these big spikes in our training load. And if you were to watch the live that I've done on tendon injuries, we speak about more of that on there. It's also being mindful with doing things around the house that you wouldn't normally do, like my example of sort of doing some DIY at home, just because it's such a typical one. You know, if you've got, I don't know, trying to screw something in to do some flat pack furniture, and you've got 3 bits of flat pack furniture to do, don't do them all in one day. The temptation is, because you're like, oh, I want to get this done, don't want this sitting there hanging around, but actually we should probably be leaving it just a little bit of a gap in between, of a day or two. The other really common one as well is people, like, particularly after Wimbledon, pick up tennis, for example. They're like, yes, like tennis is amazing, I've been watching Wimbledon, like everyone's amazing, I'm gonna go and start tennis. Great, so happy that you picked up a new sport. But some people just go in all guns blazing, and they want to play tennis, and they then go, okay, I'm going to play 3 times a week, I'm going to play 5 times a week. And that's where the issues come in. You just start with once, build from there, and see what your tolerance is like. So yeah, in summary, medial and lateral epicondylopathy, or golfers and tennis elbow, are tendon related injuries. They come as a result of repetitive overuse and overload. Quite typically we diagnose them based on what you're telling us about the area of your pain, where it radiates to, whether you're struggling with your grip and that kind of thing. And then also we do lots of our testing to see what's weak, what's strong, and our special testing. Treatment, exercise, massage, mobilisations, acupuncture, ice, all of these things that might help you reduce your pain and increase the tendon health. And then prevention. Don't do lots of stuff that you're not used to start with. Brilliant. If you have any questions, just pop them in the chat. I'll give you a minute or two. And if not, or if you think of them at a later date, then just let me know. If, of course, you have got an elbow injury, then please comment below or just message us. We'll let you know how we can help you, how our initial assessments run, so that we can get you the help that you need. But yeah, ask away any questions you may have. Don't think anyone's got any. Like I said, if you do, just drop me a message. Thank you so much for joining. Have a good, lovely, hot evening. Bye.